Awesome. Thank you. So we're going to go ahead and get started. And if you do have any questions, please put them in the chat, or if you feel more comfortable privately messaging me, that is fine. I will extend those questions to Dr. Jones as well. So I'm going to go ahead and pass it over to Dr. Jones.
Hello, thank you so much for inviting me, and I appreciate this opportunity to talk about COVID-19 and vaccinations. And a lot of you submitted really amazing questions that I'll include throughout this presentation. And then at the end of the presentation, if you have any additional questions, I can be sure to answer those. So just an introduction about me. I'm an assistant professor of bioengineering at UT Dallas. And I'm also an assistant professor of surgery at UT Southwestern Medical Center. I'm currently working on two NIH funded studies. One is on sepsis and to engineer tools to be able to detect and treat sepsis. Sepsis is the overreaction of your immune system to a pathogen. And then I also just have a new study, a collaborative study with University of Florida, where I'm looking at ways to understand how viruses evade the immune system. I got my undergrad at Cornell in biomedical engineering, and my PhD at UC Davis. I also previously was a assistant professor of immunology at Virginia Tech. So here you can see this is, I'll pull up my laser pointer so I can point to what I'm talking about. So you can see here is the lab that I'm sitting in currently in Richardson, and this is where me and my team of 5 PhD graduate students run our research experiments. It's really amazing because we're right next to the Texas Instruments clean room, and so we can microfabricate a lot of our devices that we're using for our research there. And then here I just wanted to introduce also my family. This is my 100-year-old grandmother, Gigi, and this is my daughter. I have 2 little kids, one in 3rd grade and one in preschool. And Gigi got vaccinated. Here's a picture of my daughter, very excited to get her vaccination and get back to some sense of normalcy. So this is my family. And for my research, I make these small microfluidic chips where we can put in fluid in very, very small nanoliter volumes. And then we can actually, here in this middle image, you can see these are immune cells. These are particularly neutrophils, which are our first response against infection. So these are innate immune cells. And you can see that I put a signal here that would mimic an infection. And you can see that these little cells are migrating through these channels that are about the size of a hair. And I can actually take time-lapse images or movies of these cells migrating and then get a lot of detailed data about how our immune system is functioning. And what's cool about this is because it's so small, you can get a droplet of blood from a septic patient or a patient that's immunocompromised with a kidney transplant, and then look at how their immune system is functioning. Here is a picture of us working in a clean room, and you might think, because this lecture is on SARS-CoV-2 and COVID, that we're wearing these, very protective suits to be able to protect us from a pathogen, but it's actually the opposite. In a clean room, we're wearing these full suits in order to protect our small little chips or our devices from any particles or dust in the atmosphere. And so using these clean room technologies, founded by Texas Instruments, is the same process that the semiconductor industry uses to fabricate the chips in your phone or the computer that you're watching this lecture on. So that's a little bit about me. And today I know all of you are here because you're interested in learning more about SARS-CoV-2, immunity, vaccines in both adults and children, variants. Right now, the main variant spreading around Texas is Omicron and the United States. So more than 99% of infections are caused by this variant. A lot of you, several people, I think 3 people asked questions specifically about masks. I can also talk about rapid testing, and then also how really this public health and mitigating the spread of COVID and disease is really going to be a group effort for all of us in Dallas. So I wanted to start with a little bit of background. And so this presentation will be some background in virology, some background in immunology, and then some of the specific statistics from scientific studies studying vaccines and transmission rates. But I just wanted to start with the very basics of virology. And so, this is a picture you can see. Let me move my image so you can see this better. Sorry. There you go. Okay, so here you can see this is a picture of SARS-CoV-2. So that's the virus that causes COVID-19. So SARS-CoV-2 is the virus itself, and COVID-19 is the disease that it causes. And you can notice here that it's this very small particle. And what you'll notice is that there's this spike on the outside of the protein, of the outside of the virus. These orange spikes right here are the spike proteins on this virus. And that's actually the key and the way that this virus gets into your cells. And we know that this is a very small particle. It's about 100 nanometers in diameter. And so these viruses are only visible with electron microscopes. There is a twisting strand of RNA within this virus, and that gives all the genetic information for this virus to utilize the human machinery to replicate and spread and multiply. So you'll notice when I talk about the spike protein, this is what I'm talking about. So here, once again, this is a zoom in. So here's the SARS-CoV-2 virus particle, and on the outside are these orange spikes. And so this spike is the key into the host cell, and the way that this spike enters cells is that it binds to the ACE2 receptor on your own cells. So cells in your lung, ACE2 receptor is very common on cells. It's in the GI tract, it's in the lung, it's on many, many cells. And because the coronavirus is systemic, this cell is able to bind to and enter many tissues in the human body. And most commonly, we'll talk about how that you breathe in SARS-CoV-2, and then it can bind to the ACE2 receptors on your lung cells and affect your lung cells. We know that there is low genetic diversity, and the mutations, we're constantly as scientists watching the mutations that arise in the spike protein for many, many reasons. One, it's because that's the key to be able to get into our cells. And two, the vaccines and human natural immunity are all based on our immune cells being able to remember and recognize the spike protein. And an update for the Omicron variant. So you know that we've had many different variants of the coronavirus, which is why we continue to get these spikes, going up and down of the amount of virus in our community. The Omicron variant contains about 50 mutations not seen in combination before. And 30 of those mutations are on the spike protein that I was just talking about, the key that allows it to get into cells. And so these collection of mutations enable the variant to evade immunity from previous infections. So that's why if someone had the Delta variant before, they're still susceptible to get Omicron again. And it's, right now the data is really leaning towards the fact that that causes a less severe disease than other variants. However, it's very, very contagious. And so the fact that it spreads to so many people, even though it is less severe, is concerning. And so here is a graph of basically the different variants. The ancestral strain from Wuhan back 2 years ago. There have been the Alpha variant, Beta variant, Gamma variant, the Delta variant that started in India and then spread to our country as well. And now 99% of the viruses in our country are the Omicron variant. Okay, and so I've kind of interjected different questions from the audience. So hopefully those of you in attendance, I really appreciate you for attending. And hopefully these are some of the questions that you asked. There were 10 questions that people submitted for this lecture, and they're all really, really great questions. So I really appreciate you asking these questions. And so one person asked me, do you think COVID will be as common as the chickenpox back in the 90s, meaning everyone will experience it? And so this is such a great question because it alludes to a couple things. It talks about, how transmissible and contagious this virus is. And, basically also I want to talk about how we deal with really contagious infectious diseases. And so, I would say yes. Omicron especially is very, very contagious. And so I think that everyone in our community will be exposed to SARS-CoV-2. However, one thing that's and I hope that I can prove that to you and convince you of that during this lecture, is that the experience of having, even though everyone will be exposed to SARS-CoV-2, the experience of having the disease or COVID-19 will be night and day, depending on variables for you personally, like your age, your vaccination status, which is something you control, and pre-existing conditions. So for chickenpox, I do want to point out that you can see here that this is, one of the great examples of how vaccines save lives. Before U.S. vaccinations began, there are about 100 children deaths or 100 deaths total every year from chickenpox. And then after vaccination, there's only about 20 deaths per year. So there's, more than a 80% decrease in deaths. And you can see that here broken down by age group, that, in the less than 1 year old population, this dramatically decreased as vaccinations were introduced in the mid 90s. And so, things to point out here is that 100 deaths per year is tragic because children shouldn't die. But you can see that there are, 8 or 9 times that for COVID-19. And so that even though an infectious disease may have a very, very, very small and rare percentage of death for children, in our society, we vaccinate that and treat that so that we can reduce that number to 0, because children shouldn't die. So that was a really great question. And even something like polio, the death rates were low, but we still vaccinated it to prevent not only deaths, but also preventable side effects. And then one other concept that I wanted to bring up is, with that question about, well, is just everyone going to get it? Because I know that when, people in my generation, it was common, people would talk about something like a chickenpox party where you invite everyone over and just give everyone the chickenpox, get it over with. Well, that's not a good idea, especially with SARS-CoV-2, because one, we're experiencing a dramatic peak right now. And so you can see that I remember that in the beginning of the pandemic, even before vaccines, we had a lot of talk about flattening the curve. And so it's important not to just spread this virus and for us to incorporate protective measures into our society, even if, let's say, everyone is going to get this virus. And that's because you can see here that if this number of cases just dramatically peaks all of a sudden, it's going to overwhelm our healthcare system capacity. And so delaying or, making sure that we don't, doing the things in our control to be able to delay spread of this virus. Even if you do get COVID, if you've delayed it some, then you're actually helping out the healthcare system. And so, and with this, we've saved millions of lives because we were able to flatten the curve early in the pandemic with protective measures. And in that way, we were able to vaccinate many, the majority of our seniors in the community. And so those seniors that are vaccinated are now protected from death. And so by flattening that curve and instilling protective measures in our society, we gave time for scientists to develop the vaccine, make sure that it was safe and effective, and then we're able to protect those people. So we've already saved millions and millions of lives by these protective measures and flattening the curve. And I just wanted to show, this has been such a rapid learning curve for everyone in our society, and especially scientists. I used to teach immunology and in 2020. And so this is one of the slides that I pulled out from my college class. In this slide, I presented in January, so almost exactly 2 years ago. So this was from January 22nd, 2020, where I was pointing out to the students that to be aware of a current event of a new SARS-like virus that had killed 6 people in China and infected 300 others. And I mentioned that, clearly this could potentially be contagious, and that there have been people looking at this because the virus could potentially spread during the massive annual Lunar New Year migration. And so, this is just really crazy to see how fast things have ramped up. And this is from an update from just this morning that I took a snapshot of this Johns Hopkins COVID-19 dashboard. And you can see the number of cases went from this 300 cases in a localized small town, in a localized city in China, to having over 300 million cases. And so, in our country alone, we've had 73.5 million cases, and we're approaching 900,000 deaths. And so this has been in a very, very rapid time frame of about 2 years. And so this is, interesting for scientists. All of us have gotten on board and are really putting a lot of effort into studying and understanding this. And this has been a huge success with the scientific community to create a very, very effective vaccine that almost reduces the death rates down to 0%. And so you can see that this is I don't know if people in the audience have heard of this, but scientists, we often will look up information. So this is basically like Google for scientists, and this is the National Library of Medicine. And so you can type in topics that you're interested in looking up research papers in this PubMed.gov online resource, and it's similar to Google, and you'll get results. And so you can see that even in the last 2 years, over 222,000 peer-reviewed publications have been published on SARS-CoV-2 or COVID-19 alone. And so there has been a tremendous amount of research and effort in really understanding this virus, developing vaccines, developing tests, developing therapies. And so this is, I think, an astounding success of the scientific community. And so, as to put the significance of what I'm talking about here, clearly cases and deaths in the U.S. Have been up. Now they're they're currently downswing on the downswing after this peak of Omicron. But even on Thursday, there were almost 600,000 reported cases of COVID-19. And the deaths, and you'll see that the death rate following this peak will remain higher, and it's about a month lag behind that. But you can see that there were 3,600 deaths, or 3,599 deaths on Wednesday. And so, the death rate is still quite high, even though we have a very effective vaccine. I work at UT Southwestern Medical Center, and they have some of the best epidemiologists in the whole country working there. And they're able to very, very accurately forecast and predict past and present cases based off of the data. And so here you can see this is, and I have the link here, so they update that about once a week from these world-renowned epidemiologists. And you can see that that the COVID-19 hospitalizations have increased in recent weeks, and this is up with this Omicron wave. And the blue line, this blue estimate here, shows the estimated number of hospitalizations for the last 3 weeks. And the Dallas County total COVID-19 hospitalizations could peak around 1,500 concurrent hospitalizations before the end of January. And new COVID infections are expected to peak above roughly 7,000 new COVID-19 infections per day before the end of January. But what's interesting is really the Dallas County's trajectory still depends on our behavior, and especially our vaccination status. And so you can see here that really we can control this. This pandemic is within our control, and we should be able to get it down to endemic rates if we all work together as a community. You can see here that on this graph, you see all the different waves. So this is Delta and this is Omicron. So this is, in 2022, we have this spike. But what you see here is that the future really depends on how we behave. So if we end all mitigation measures, so if we stop wearing masks, no one else gets vaccinated, we just have huge parties, this red line can be, we'll see this tremendous spike here and in occupied hospital beds. However, if we can just control this by the behaviors of January, current level of mask wearing, social distancing, and some business restrictions, we can really dramatically reduce that peak. We have had about 211 million people that have been fully vaccinated in the US. And this includes more than 86.5 million people who have received a booster shot. So here are the totals, and there was clearly in the United States this initial peak when the vaccines rolled out, and then a peak here more when the boosters also rolled out again, and the age range restrictions were lowered, and also the increase of booster shots. Here is in Texas. So Texas has fully vaccinated over 17 million people. And so that covers about 63% of the eligible population of 5 and older, and about 58.7% of the entire population. So that's because children who are 5 and young, or children who are 4 and younger, are not eligible for a vaccine. And about 5.7 million people have received a booster shot, and so that's about 33.8% of the fully vaccinated people. And so I think this is actually the most important question that was submitted to me before this lecture by one of you, is how effective is the vaccine? And I would say that the next several slides that I'm going to show are the most important. If you take nothing else away from this lecture that I'm giving, that this is the most important thing that I'm going to present. And so here you can see this is the rate per 100,000 of the population that are hospitalized for 65 and plus. And in this data, trend is very, very similar also for 50 plus. You can see here that there's this split between, this orange line is the number of people who are hospitalized, who are unvaccinated. And then this navy line is the darker blue line is the fully vaccinated without an additional booster dose. And the light blue line is fully vaccinated with an additional dose or booster dose. And so you can see this huge discrepancy, and it's almost down to zero for people who are vaccinated, but the levels are increasing, with each peak for this unvaccinated population. So this is a really important graph to understand that you can almost reduce your risk of being hospitalized from COVID-19 by getting vaccinated. And here, and this is data that's published from the CDC from both Switzerland and the United States. And this is just one of the most clear graphs that really demonstrates this. So this is the United States weekly death rate by vaccination status. And so here you can see the bar graph of the death rates are so 9.74 people per 100,000 people that are unvaccinated. Fully vaccinated without a booster, that goes down to, that's more than a 10%, 10 fold. So order of magnitude decrease. So down to 0.71 per 100,000 people. And then if you're fully vaccinated and boosted, it goes down to almost zero. So the majority of deaths in this country are from this unvaccinated population. And then if you mirror that in another country, if you take that same data set, it's almost the identical statistics of higher rates with the unvaccinated versus fully vaccinated and fully vaccinated plus a booster, which reduces in Switzerland down to only 0.07 people per 100,000 people. So pretty much down to zero. And then I think another really important question, and I think what people have some hesitancy about is asking about negative future side effects of this vaccine. So I hope with those last slides that I really prove to you that the vaccine is effective and it can reduce both hospitalizations and death rates. And so my short answer is for negative future side effects, I would say no, especially long-term side effects. The side effects of the vaccine are very, very rare. And normally they're short-term and immediately following the vaccination. So the side effects of a vaccine are from that initial immune response to what's in the vaccine, and I'll explain how that works. But the common side effects you'll get are redness on that arm, swelling. You'll get tiredness, headache, muscle pain, chills, fever, and nausea. But that is in the several days or a week following your initial vaccine dose. And these side effects are from your immune system reacting to the vaccine, not from the vaccine itself. There are a very, very small percentage of people that are allergic to some component of the vaccine, and that can, there are some very, very rare like immediate anaphylactic reactions to vaccines, and this is extremely rare. There has been a lot of talk about myocarditis, and you can see that the number of myocarditis cases. Myocarditis is an inflammatory response in your heart. And from the vaccine versus from actually getting COVID without the vaccine are very, very small. So there have been in 24 to 29-year-olds, only 2 or 15 to 18 in males. So it's more common in males from the vaccine. But if you look at and compare that to without the vaccine and getting the virus, without being vaccinated, these numbers go up to 8,500, 12,000, and 15,000. And so really, I would think that you really need to weigh the risks and the benefits. So even if there are some risks of getting a vaccine, you need to weigh that and balance that and compare that, to something, to the benefits. And so what would happen if you're not vaccinated? I see something in the chat window. Let me pull. Sorry. That up. I can. Oops.
Oh, it was just me putting in the chat. If there's any questions, they can add them.
Okay, perfect. Yeah, and just let me know if anyone, because I can't see the on my viewpoint, I can't see the chat window, but just read to me if anyone writes in there. You can just interrupt me, and I'll, since it's a smaller group, just interrupt me if anyone has a question. I'll answer that.
Sure, sounds good.
And then this was another question from this group. Even though vaccinations are strongly encouraged and even mandated in many places, how does building up one's immunity system, our immune system, building up your immunity or building up your immune system figure into this COVID situation? If immunity is important, what vitamins, minerals, and/or supplements should we take? And this was a very, very common, two of you asked this, and I get asked this all the time. And so one person asked, what supplements should you take to kind of improve your immune system? And then one person asked specifically, if we get COVID, is there something we should take? And so I think from the main focus of this lecture is that immunity is critical. And so having immunity and having your immune system recognize SARS-CoV-2 is really what's going to provide you, reduce any risk of death and reduce any risk of hospitalization. And immunity is really what's going to shift this pandemic to an endemic. But what I want to stress is that immunity from the vaccine and natural immunity, so from getting COVID-19, are similar. You're teaching your immune system, how to respond to. You're teaching it, so you're showing the immune system this is what is this is the virus, and we specifically are teaching it to recognize that spike protein I talked about in the beginning. And so the vaccine is able to teach your immune system about this spike protein without any of those harmful side effects. And immunity from the vaccine can last longer than natural immunity because you're teaching your immune system while you're healthy. So you can imagine that if you're unhealthy and you have this high fever and you're not feeling well, we know that it's harder for our immune system to learn and have a longer memory. And so, I wouldn't as much separate these ideas of I hear a lot of people talking about the natural immunity. It's not like, I almost think of it as like people are talking about natural immunity as if it's like an organic food or something. I mean, having immunity is having immunity. Your immune system, you have B cells, and we'll talk about this, but you have B cells that can produce antibodies against the virus, and you have T cells that can remember the virus and kill any infected cells. So having that acquired immunity, you can get it from a vaccine where you have very, very small side effects, or you can get it from getting SARS-CoV-2, and the risks are much higher. So really immunity, and what I'm focused on is immunity. It's critical in ending the pandemic. So that's a great question. I'm not a nutritionist, but I do study a lot about the immune system. And we do know that, vitamin C, that's kind of a wives' tale that's been known for time. Like if you're getting a cold, drink orange juice, and vitamin D, from the sun can improve immune function. However, I would say that a healthy diet is the best way to get proper nutrients and vitamins, and not necessarily taking high doses of some supplement. So I would say that eating an orange or drinking orange juice, or going out into the sun, can be more beneficial than taking tablets of a certain vitamin. And healthy diet, I think, is critical in not only your immune system, but just your overall health. And we know that obesity is a precondition, especially in children and adults. It's a pre-existing condition that really predisposes you to hospitalization or even death from COVID-19. And so having a healthy diet and an exercise regime, and this normal slot of doing yoga and of relaxing and reducing your stress, that can really impact your immune system. I've done some studies on omega-3s and how these resolving the anti-inflammatory or pro-resolving properties of omega-3s from fish are incredible. I personally take fish oil, but I think, like I said, again, eating fish or eating salmon, eating some of these healthy fish that have the omega-3s in them is better for you than taking a supplement. But there are in omega-3s, there are properties that can resolve your inflammation. And then after you get COVID, I would say, obviously, like taking care of yourself as if if you're sick, making sure that you're getting enough rest, drinking enough fluids. But there's no supplement that you can take that will just get rid of the infection. The only type of drug, the main type of drug that people are taking after infection are monoclonal antibodies. That will actually bind, antibodies or proteins that will bind to the spike protein and make it and inactivate that virus and make it impossible for the virus to infect cells. But what can make what can make antibodies are your immune system. So B cells make antibodies. So you can actually just get a vaccine, and then you'll have cells in your body that are going to make these antibodies as soon as you get infected. And so, I would argue that, the most important thing to get immunity is getting the vaccine. And so what is a vaccine? Just to start from the beginning, it's a substance used to stimulate the production of antibodies and provide immunity against one or several diseases. And it's prepared from the causative agent of a disease. And so what's interesting about the vaccine that that Moderna and the Pfizer vaccine is that we are introducing a mRNA, a instruction for our the muscle cells in our arm to make that spike protein of the virus, and so then our immune system can learn it. And the origin of vaccine is from vacca. It's from cow. And I'll talk about that a little bit, because the first vaccine was actually when they would take some of the cowpox virus that milkmaids were exposed to. They noticed that milkmaids who were around cows a lot did not get smallpox at all. And so they took some of this cowpox virus that was similar enough to smallpox and would vaccinate people, and then they would not get smallpox. So that's where a vaccine comes from, is cow. There's a major public health impact. Vaccines save, and this is even before the pandemic, more than 2.5 million children's lives each year worldwide. So that, just to put that in perspective, vaccines save enough children, the amount of children that are in California every single year. So this is the third most impactful public health intervention behind hand washing and antibiotics. There's a ton of misinformation and polarization about vaccination. There was a there was some celebrities that were talking about the fact that that vaccines cause autism, and that stemmed from this retracted Lancet article from a scientist that was fabricated, that claimed that there was a link between autism and measles, mumps, and rubella. However, there was a lack of scientific rigor, and this study has been retracted. So this study was false, and there has never been a single scientific study that linked autism with vaccines. There are a lot of other, myths about vaccinations. One is that vaccines are just for kids. Obviously, we're getting our flu shots and we're getting our COVID vaccines. Adults can and should get vaccinated. Vaccine preventable diseases outbreaks don't occur anymore. I think that's clearly been disproven by this pandemic. There's a myth that vaccines aren't safe. Vaccines undergo extensive testing and monitoring before approval. Prevention is out of my control. I showed you that from the UT Southwestern data that we really have control. And also timely vaccines can protect you from infectious diseases. Another myth that's really important during this pandemic is that you can't get vaccinated while pregnant. And it's been shown that it's really, really helpful for pregnant women. Pregnant women, that is a pre-existing condition where you're more susceptible to disease. And so when women get vaccinated while they're pregnant, that protects them from getting COVID-19, so that protects their health and the baby's health. And then also after that baby is born, they will have some immunity to SARS-CoV-2, and so they're protected during that initial window when they're more immunocompromised and very young.
Hi, Dr. Jones.
Yep.
I'm going to interrupt you really quick. We just got one question.
Oh, perfect.
Yeah, I'll read it. It says, you just mentioned eating fish for their oils. I've been told that only wild-caught fish have beneficial oils, but you cannot always purchase wild-caught salmon, for example. Does the oil in farm-raised salmon provide the same benefits?
That's a great question. And so I personally eat wild-caught salmon, and what I'll do is and it's actually not, it's the reason I do it is not necessarily for the difference in oils. It might be for some of the contaminants or higher levels of mercury. But I do know that wild caught fish is healthier. And what I do is I'll buy it and then freeze it. And so you can freeze it and then thaw it and cook it. So I'll buy a larger amount of it and at Costco or Sam's Club or something like that. And then I freeze it and then I cook it. There are some farm raised practices that are doing this in a more sustainable and healthier way, where where maybe they're not kept in a small tank where there are more toxins. And so I think we're going to get some improvements on farm raised fish, because I know that can be better for the environment. But that's a really good question. I personally do agree that wild type fish is better for you. But if you can't get that, then getting the farm raised is better than nothing. So I would say that it's kind of a tiered thing. So I do eat, I have eaten farm raised fish, but I prefer wild caught, just because I do think that, like you said, the nutrients are better. But thank you for that question. And if you have any more questions, just ask me. And what I always eat, I just buy it and freeze it. And it tastes really great. So I think that's one way to get around it, but it is more expensive. I agree with that. You can also get canned salmon, red salmon or pink salmon. And you can make like salmon burgers or things like that are from wild caught salmon as well. Let's see. So yeah. And so why do we get vaccinated? I think that there are some people who, let's say you're younger and you're really healthy and you're not worried about getting COVID, you're going to be fine. But I would say to still get vaccinated, even if you're in that demographic that's has a very, very small percent of side effects, because you really can do it to help your community. So you can see here that if only some people are vaccinated, that causes to more spread. But if we can get more herd immunity, there are some people who maybe are immunocompromised. So even if they get the vaccine, their immune system can't remember and they don't have immunity, or they're much, much older, like my 100-year-old grandmother. I got the vaccine for myself, for my own health, but also for her health. Like when I'm around her, I don't want to risk, I'm in a college classroom with 50 college kids, and I don't want to risk bringing back the virus to her. So I get vaccinated to promote that herd immunity. And so there were some, countries that were proposing to just let the virus spread, get herd immunity, get this natural herd immunity, and only protect the vulnerable while we're spreading this. But there are several errors in this. And so I think that getting vaccinated is a better solution than just letting the virus spread naturally and letting that cause the herd immunity. One is that even if 70% are infected, that could be too low for herd immunity with something like Omicron. The error is that it's very, very difficult to protect our elderly. So my, grandmother has caretakers, and most elderly people do have people that they're around, and so it's almost impossible to just isolate them. Also, many mild infections get long COVID. So death and hospitalizations are not the only thing that we can protect against. Dying is not the only issue. We want to protect it also against any of these other side effects. And natural antibodies wane quickly. So we see that with Delta and now this Omicron wave, is that there's a lot of people who got Delta and now they're re-getting Omicron. And so this is not just a one and done scenario where once you get and survive getting COVID, that you're going to be fine for the rest of your life. There's high levels of reinfection, and that this will occur year after year after year. And this new variant, so like the Delta is R naught around 5. I think Omicron could be, I've seen calculations as high as 8 to 10. So that means that each person that gets Omicron will infect on average about 8 other people. And so that are able to break through immunity from past infection. So really the best way would be to get vaccines. And like I said, vaccines teach the immune system to fight infection. They place immunity there before the pathogen arrives to contain and clear before the disease. Sometimes vaccines redirect the immune system responses that have already been learned. And the vaccine makes sure the immune system remembers. And so that the ideal goal is to ensure lifelong protection against the disease. And then sometimes you'll need boosters, let's say like for the flu vaccine, where there's different variants of the flu, or for COVID, you may have to get a booster, each year to be able to protect yourself for your whole life. And so nearly all vaccines are given repeatedly to induce a robust immunity. The response is given as a prime. So basically here on this graph, you see that the antibody levels, this is the number of antibodies, the arbitrary units of antibodies that you have in days. And so you'll see your first lesson, you're teaching, about a week after your first lesson, against this primary challenge, you start building up antibodies. And so you're teaching your immune system, your B cells, to make these antibodies against the virus. And then after your booster, let's say a month later, then you have a much higher secondary response. And you have many, many more of these memory B cells that can produce antibodies that bind to the virus. And so your first dose is to teach your immune system. And then your second dose is to tell your immune system, okay, you need to remember this. And, if we're exposed to this again, you need to fight against it. I mentioned this already, the first example, one of the first examples of vaccines was in 1760, when Jenner noticed that milkmaids did not get smallpox. And so he was able to take and he realized it was because they had immunity because they were exposed to cowpox that didn't cause disease in human, but was similar enough to smallpox that it would cause immunity. And then he could give that to children, and then they were protected and had immunity against smallpox. But there's been vaccination in the 17th and 18th century in China and Greece. You see depictions of these in artwork and pottery. In ancient China and Greece, they became aware of the possibility of delivering immunity to infection. Jenner modernized immunization, and Pasteur developed the germ theory. So really understanding what they were doing, what caused germs and viruses cause disease, and then being able to define which germ caused the disease, then you could get a target for a vaccine. And then Koch also developed tools to grow bacteria. So there's really been a building of knowledge over the last 100 or 1,000 of years. And I think another misconception about the COVID-19 vaccine is that people are super disappointed and shocked that we need to get boosters. But I would say that for most vaccinations that we do need boosters, over our lifetime, and some up to 3 or 4 shots. And this is an example of all the vaccines that we commonly get, and no one worries about it. And even the hepatitis B shot we get on the first day we're born. So everyone gets a Hep B shot the first day when they're first born. And then some other vaccines like MMR, measles, mumps, and rubella, you have to wait a year in order to get it, because your immune system needs to develop in order to be able to build up immunity to these 3 diseases. But I would just say that, yeah, to just go back and see all the vaccines that you've had. And so, really what the dogma of vaccinology is that we will teach our B cells, some of our adaptive immune cells, to be able to create these magical antibodies that can then, so this green sun right here would be SARS-CoV-2, and these antibodies that are shaped like a Y will specifically bind to the SARS-CoV-2 and then inactivate it, and you won't get the disease because these viruses can't infect your cells. So B cells are the main player that make these magical antibodies. And when you get monoclonal antibodies, you're just injecting yourself with these proteins that then inactivate the virus. So it's smarter and easier to really just program our B cells to be able to make them whenever we need them or whenever we're exposed to a virus. And so this table goes over exactly how innate immunity, how natural immunity works and how viruses work. So what happens is if you have the coronavirus infection, I showed you this. This was the first picture I showed you of the SARS-CoV-2 virus. It has the spike protein on an epithelial cell in your lung. Then it's taken into the cell, and then it goes in and it's ingested. And so your immune system will then recognize it. So you have specific cells, T cells, they're called T helper cells, that have receptors on their surface that will see that spike protein. And they tell B cells and cytotoxic T cells, they tell the B cells, okay, you need to produce antibodies. And they tell the T cells, okay, kill any infected cell. And so this is how our immune system works. And when you have a vaccine, you basically will either inject a weakened virus or just a piece of that virus into your cells. And what the nucleic acid vaccines, the Pfizer or Moderna vaccines do is that they encapsulate a piece of RNA that encodes for that spike protein. They encase it in a lipid coat. They inject it into your cell, and then your muscle cell will make some of these spike proteins and will teach your immune system to recognize that. So then you'll have memory B cells that will make antibodies against the spike, and you'll have memory T cells that will help boost the response or kill any infected cell. And this is not a change in your DNA. This mRNA is very unstable. That's why many of these vaccines have to be stored at -80. So this is a very short window of once this mRNA is in your cell, it's in the cytoplasm. It doesn't go into the nucleus of your cell. Your cell will make spike protein for a short time window, and then the RNA is degraded, and then basically those components of the vaccine goes away. And the only part that's left of that vaccine is just your immune memory. So it's your immune response that really induces memory, not some chemical from the vaccine. The vaccine is only really teaching your immune system. And that's why the reaction to the vaccine is only a very short, if you have a side effect, it's only that short window of right after you got the vaccine and your immune system is responding to it. That's when you have those side effects of maybe a fever or feeling chilled. And there are a bunch of,
Got another question.
Okay, perfect.
Yeah, it's saying I am on, I hope I'm pronouncing it right, Amovig that blocks the monoclonal antibodies. Does this have a negative effect on me in regards to COVID?
That is a, yeah, I'll look that up. And if you just email me, um, I don't want to answer, I don't want to give an incorrect answer, but I would ask your physician, because anything that can impact your antibodies, potentially could have, um, if you're immunocompromised in some way, that is kind of a pre-existing condition. You might want to be more careful, and then just make sure that when you get the vaccination, that you do get immunity to COVID-19. So that's definitely a great question, and I would definitely ask your primary care doctor, about that implication. But I would say for anyone who has, um, often for like autoimmunity or for some of these autoimmune diseases, you have to take drugs to suppress your immune system. And obviously that's really important to keep um, your autoimmune disease under control. But for that can also have a suppressive effect on your immune system, and you may want to be a little more careful or make sure that I would definitely suggest getting the vaccine. And so we have about 5 more minutes. And so I'll just quickly go through some of these last, and I can send out the slide deck too for people who are interested. But, we have a bunch of different vaccines. The main 3 in the United States are Pfizer, Moderna, and then J&J. Pfizer and Moderna are both based off of that mRNA platform that I just talked about. And some of the things that we still need to understand as scientists, and what I'm really interested in researching, is really how to direct immunity to target tissues, establishing tissue residence. I saw a really cool article just came out on a nasal vaccine, so you wouldn't have to get a shot. You could just breathe in, and that could have immunity in your mucosal, in your nose and in your mucosa immune system. And then how pre-existing immunity shapes vaccine response. I've seen some preliminary studies showing that pre-existing immunity and then getting a vaccine, you have almost this like super immunity. So pre-existing immunity just even helps your immune system remember even more. So if you've had COVID, I think it's still worth getting a vaccine. You're going to have really, really great immunity after that. How vaccines work in neonates and the elderly. One of the great things about preliminary studies is that these vaccines work amazingly in the elderly. So they're super protective of this vulnerable population. Unfortunately, the first studies of Pfizer showed that in children under 5, they used a very, very, very low dose of that mRNA. They wanted to use the lowest dose possible to, prevent any side effects in children. And that very, very, very low dose did not give them enough immunity in only 2 shots. So now they're working on the 3rd shot. So likely in children in under 5, it's going to be a 3 series vaccine of a very, very, very low dose. And my son, who's 3 now, as soon as that vaccine is approved, I'm definitely getting him vaccinated like that first day. So I think it's important for children. Antibodies, how they cross barriers, whether vaccines can drive innate memory. And one thing that we all want to know is how long will this memory last? Are we going to have to get a vaccine every year, or will our memory last longer? It does seem that memory for preventing infection, so preventing getting COVID at all, is different than the memory to prevent, that strong immune system that can prevent going to the hospital or death. So it seems like that memory of preventing the hospitalization and death is pretty good in even 2 shots, but a 3rd can boost your immune memory so that you don't even get, you have a less chance of even getting the infection. And then also clearly scientists are really critically looking at whether these vaccines will be effective to the different emerging strains. And so Omicron, because it had so many variations, the vaccines weren't as good at, preventing any infections. There are some breakthrough infections because these vaccines were designed with the spike protein of the original variant. And so this has 50 changes on that spike protein. And so although they're extremely effective at preventing deaths or preventing hospitalizations, there are still some breakthrough infections. And so Moderna and Pfizer are now creating specific vaccines against Omicron that are really designed for that, for the 30 changes in that little spike that I showed you. Yeah, and really effective vaccine campaigns. I think that, our vaccinations are free. Although, I was waiting in line to get antibiotics for my child and someone came up to get a vaccine and they turned her away, which made me upset. But I think that we have to be able, some of the grocery stores are requiring appointments online. But I think that there should be a lot of options for people just to walk up, make it easy. People have jobs they have to go to. So making it really easy for anyone to get vaccinated. I think that's something that our country will need to focus on. And then one other question, so this is not about vaccines, and I can close with this, is that, there's been a lot of also controversy about masking and, the quality of mask that you need. I personally use this, this is a KN95. And, I'm around a lot of people. I teach, I'm around students. I work in the lab. I work with human blood samples. And so I wear this certified KN95 that I know is from a reputable company. And so I would, and this is the, I put this link of, this is the one that I use. It's a company in Texas that I trust. And then, yeah, so here's, there's also N95s. And I would suggest using a higher quality mask because we know that Omicron is much more transmissible, it's airborne. And so for reducing the spread for all those reasons that I listed, I think that, doing as much as you can. So getting vaccinated, wearing a mask, not going to huge parties. If I go indoors and if I'm around a lot of people, then I do wear a good mask. And I, at the beginning of the pandemic, I was wearing some of the cloth masks. But I think as this, as I've seen that this is really airborne and the Omicron is so transmissible with such a high R naught, I wear a good quality, high quality mask that I buy from a good company. And here's some of this, there's a bunch of companies you can buy them from. And this is the CDC. And I don't change mine every day. I probably wear mine until the strap breaks or I rotate them. And so I get a lot of wear out of it. And I think it's worth it. There are also, rapid tests. I know I should have included the link, but there's a link that you can go to, and I can send that out. But there's a link where you can get 4 free tests. You just send in your address, you can get 4 free rapid tests. But that's also, if you're going to be around one of your elderly relatives, or if you're going to have a party, or if your kid has a cold or is sick, and you want to make sure that you don't send them to school and spread that, then some of these rapid tests are really great. And so, and this one right here is from Abbott, but there's a couple companies that you can get, and it's really easy. You just take a swab and you run this assay, and if you see 2 lines here, then it's positive. So I would say those are kind of the other things to end the pandemic. What does 2022 look like? I guess the best case scenario was that the viruses would get no worse than Delta, but we know that. And the worst case would be that there will be continual new variants that will escape the vaccine with patchy coverage. And I think what really happened was kind of this in-between scenario. So now we know we have Omicron that causes a less severe disease, but it's very, very contagious, and there is patchy coverage for spreading, for previous immunity, especially in natural immunity. And so basically, there are these few new variants, including Omicron, that can, that can escape natural immunity or even vaccine immunity. And there will probably be a few more waves before the virus exhausts its ability to mutate without fitness costs. And we'll need some boosters before going back to normal, when the low, and the goal is for this low endemic transmission to set in. Because even though we have the vaccines, I personally don't feel that we're back to normal because, especially with my children, my son's in preschool, he's already had 2 quarantines this year. My daughter, her class is very vaccinated. And so luckily this year she hasn't had any quarantines and she's been doing well. But, for our family, we've had about 6 quarantines so far. So, for children, we really want to keep them in school and have them learning. And, as a college professor, I want to have my students in person. And so I think we need to, keep doing the things that we can do to try to get us back to this low endemic rate. Yeah, and so just to summarize, and this is a question, someone said, what is the best way to boost our immunity? I hope through this lecture, I've proved that vaccines are really the best way to boost your immunity. Everyone 5 years of age and older is now eligible to get a COVID-19 vaccine. My daughter, who just turned 9, got her vaccine. She had no side effects. She felt fine. She was excited. She can have more protected play dates. And then everyone that's age 18 and older can get a booster and can and should get a booster shot. And then just staying healthy. So healthy food, exercise, all the yoga you guys are doing, and reducing stress. So, I think there's a balance between doing everything you can do not to get the virus and then also being healthy. So I think that's also a balance that we have to do. But, I hope that through this presentation that I've showed you that there are a lot of things to do, and that we have a lot of power to end this, and we have control of it. So as a community, we need to do what we can do to protect the vulnerable in our community and to protect ourselves and our family. There was another, so that's the close, but there was another, and I won't go into too much detail because I've ran out of time. But someone asked about viruses combining with each other. And I just wanted to note that, what I've seen of Florona or some of these combination viruses are not true. And that's just really an instance of a person having both of these viruses at the same time, which is, significant, because I think that if you have both the flu and COVID, SARS-CoV-2, that can impact your health. And so, having two things at once obviously makes it harder for the physician to treat you. But I think more and more what we're really talking about is the mutations. And so we know that viruses are constantly changing. Their genetic code is prone to changes called mutations that can change how the virus looks or affects its host. And scientists know where these mutations, like if it's on the spike protein, that can cause our natural immunity, our vaccine immunity to be affected, because it'll change that spike that our immune system recognizes. We know that viruses rely on hosts to survive and replicate. They invade the body of a human or animal and bind with the host cells to allow their own genetic material, the RNA, to enter the cell. And the host cells read the genetic code and replicate it, making more of the virus. The new virus then leaves the cell in search of another host to infect. And so sometimes when the genetic code is being translated into proteins, a piece of the code gets changed. This is called a mutation, and they happen frequently. Human cells are DNA based, so they're not RNA based. And thankfully for us, have much better integrity than RNA. So in humans, we don't have this. The DNA has the ability to check itself. And if there are small changes or what we call mutations to the genetic code, it can fix itself and get back to normal. But RNA is a lot more messy. So really with these viruses, we're going to have this perpetual cycle of constant replication, and there's going to be mutations, and there's going to be new variants. We know that the more people are infected, the more variants there's going to be. It's just math. And so it's really not surprising that a virus like SARS-CoV-2 would mutate. And this is really what scientists and vaccine developers have been expecting. And so it's nothing that shocks us. It's just the fact that we may need to have updated vaccines to cover that variant. There can be some recombination of viruses, meaning that if you have two strains of a virus and dual infection, there can be some hybrid new strains. So if you had, a Delta and a Omicron, you potentially could have some hybrid new strain, but I have not seen any. There have been some, slight subtle strain differences that where there have been hybrid new variants, but I have not seen any hybrid strains that are of concern in the literature yet. And so, this is recombination can bring together mutations that occur in different lineages of a virus, and that could potentially create either a more or less pathogenic strain. So I hope that answered that person's question. And then finally, one person in the audience asked, I had COVID-19 and I noticed symptoms, and I still have symptoms for so long. How long will it be with symptoms? So this is a question, this is a question really about long COVID. And I think this is also ultimately why I'm a huge advocate for vaccines, is because death and mortality rates are not the only thing. We know that this is a systemic virus that can really impact your nervous system, your heart, other organs. And so this long COVID is a range of symptoms that can last weeks or months. So you may still experience things for a couple of weeks or months. And so during that time period, I would really advocate for you to really take care of yourself and eat healthy and get more rest. This can even occur after just really a mild illness. And so this is something that I think scientists are going to need to do a lot more research on to understand how to treat long COVID. And I think that there will be more options for people in the future. But, for now, I would say that long COVID is real and it occurs in, 10 to 20% of patients. And it's something that I think that we should try to avoid by getting vaccinated. And so we do know that, long COVID symptoms seem to be shorter for people who are vaccinated than unvaccinated. But I wish I could give you more information about, certain drugs, but I'm sure that drug companies will and scientists will study this long COVID, and there will be treatments in the future. But because this is so new, I haven't seen any specific treatments, but likely it'll take a couple weeks to a couple months. And so, yeah, that's it. And just my last slide is, really vaccine equity is that, I focus mainly on the United States and Texas, but we really need to get the whole world vaccinated to prevent any of these, to prevent as many variants as possible. So not only trying to advocate in getting vaccinated in Dallas, but all over the world. So with that, any other questions that people have? That's all I have for today. But I really appreciate everyone attending. So thank you so much for doing this for your own health. And thank you for submitting so many amazing questions. That really made me feel great that you asked so many great questions. And really, I mean, the point is we really have control and we have the power to end the pandemic. And so I think we can as a community if we're united. So any other questions in the chat?
No other questions, but I do want to thank you, Dr. Jones, for coming to present with Dallas Public Library. I think this has been very informative, and patrons, from what I see in the chat, they enjoyed the discussion as well.
Awesome. Yeah. And I put my, let me see if I had my address. I thought I put my, I can put my email address too if people have specific questions. Let me put it in the chat. I'll put it in the chat myself if people have, because I think I talked too long, but let me see. Let's see. Sorry, one second. So if you have any specific questions about the science of it, I would ask me. And then if you have questions about your health, definitely ask your primary care physician about that. And that would be great. Yeah, thank you everyone for attending. I'm really happy to see, I think there's 12 people here. So that's really great and exciting. And if each of you talk to like 2 people, then we've gotten the word out.
And plus this has been recorded, so a lot more people will be able to see it as well. But yeah.
Thank you. I appreciate your time. I know everyone is so busy. Well, stay safe and stay healthy, everyone.
Yeah. Thank you for coming.
Thank you. Bye.
Bye. All right. In just a few moments, we're going to transition to Feel Good Fridays, yoga and meditation. Just a few moments. Thank you for bearing with us. All right. Okay, so we're going to go ahead and get started with Feel Good Friday, yoga and meditation. We're going to get started with the yoga portion of the program if Jarrett is ready.
I'm ready.
Awesome.
All right, welcome back. We've definitely got more than enough time to get our Friday good feeling. So we'll make our way to our mat and we'll get you that flow motion potion. So we'll start off in our